Hi, I'm Dr. Michael Taggart with Lake Washington Chiropractic. I'm a board-certified chiropractic physician with 18 years clinical experience. I have advanced training in neurology, spinal rehabilitation, and nutritional therapies. I want to welcome you to our fibromyalgia, chronic pain, and chronic fatigue recovery program DVD, where we explain how we treat patients both neurologically and metabolically. So we put this DVD together to really help give you hope that no matter how bad your condition is, no matter how many doctors you've seen without success, that if you do our neurologic and metabolic treatments and therapies, that you can get better. Now, the information I'll be sharing with you, 99% of it you've never heard before. It's somewhat technical in nature, so I'm going to do my very best to make the concept as simple as possible so you can follow along with the discussion. You may find that you need to watch this DVD more than once to fully understand what I'm discussing here today. There's a website that I want to bring your attention to. It's called lifechangingcare.com. And on this website, there are over 843 testimonies of patients that have been evaluated and treated both metabolically and neurologically with all kinds of conditions like fibromyalgia, chronic pain, migraine headaches, multiple sclerosis, peripheral neuropathy. And I'd like you to go to this website and click on the condition that most closely resembles what's happening with you and listen to some of these stories. There's amazing stories on this website. Many of these patients have been told by maybe more than one doctor that there was nothing more medically that could be done to help their condition, and they were told they were just going to have to take these medications for the rest of their life and they would learn to live with it. So by going to this website and reading some of the success stories, that's going to help give you some confidence that if you follow what I'm going to be recommending, that you can get better just like these people did too. Now, what makes our office different? Why am I going to be the doctor that finally helps you when maybe you've been to 2, 3, 4, maybe even 15 other doctors that you've not gotten help from? Well, one of the things that's going to be different is that we are not going to treat your label. Typically, people have been to a doctor where they were given a diagnosis or a label and they tried to treat that label, typically with medications, which usually doesn't work. So what we're going to do is we're going to do something completely different than that. We're going to treat you as an individual, and we're going to run some very specific tests to find out what in your body is not working. And if we can find out what in your body is not working and both address that neurologically and metabolically, we have an excellent chance to help you get better. Now, you're watching this DVD today because you've been told or you think you may have fibromyalgia, chronic pain syndrome, and or chronic fatigue. Now, when you have fibromyalgia, you typically have a whole body pain. Your pain may be worse one day, let's say in your low back, and then it may be shift and it's worse in your neck. There are also a specific number of tender points in the body that when they're pushed on make the pain worse. There are some doctors that believe those points aren't necessary for the diagnosis. So whether you truly have fibromyalgia or a chronic pain syndrome, you really don't care. You just want to find a doctor who can find out what's causing your chronic pain and help you get rid of it so you can get your life back. Now, as far as chronic fatigue goes, to have the designation of chronic fatigue, you have to have this fatigue for 6 months, and you typically have flu-like symptoms where you feel you have like symptoms of a viral infection where you have, of course, fatigue, and you have muscle aches and pains, and you have flu-like symptoms. Now, many people who have fibromyalgia and or chronic pain because it interrupts their sleep often end up with chronic fatigue. So when you come into our office, we're going to do a series of tests. Some of these tests maybe you have had and some of them you haven't had. So it's our pledge to you that we will leave no stone unturned to find out what is the cause and or causes of your chronic condition. So we're going to order some specific blood tests. We're going to order a very comprehensive thyroid panel. We're going to do what's called a complete metabolic panel on you. And we'll also check your lipids, like your triglycerides and your cholesterol. And we'll also check your right and white blood cells. Now, it's very common for patients to come to my office to say, well, doctor, I've already had all these tests and they came back quote unquote normal. So it's very important that we discuss this concept. I want you to know that there's a difference between lab normal and what we call the functional range. Lab normals are based on the averages of people who are very ill. The data that lab normals comes from is for people who are visiting medical clinics. They have conditions often debilitating, they may be on oxygen, so the data that we get to create a bell-shaped curve often is going to miss people on the low end and the high end. These people typically have obvious symptoms of organ problem, but because the data is skewed towards the sickest patients, often those patients are missed. For instance, a person may have obvious thyroid symptoms. They may have cold hands and cold feet, gain weight easily, can't lose weight, and they have fatigue. The laboratory normal for thyroid for what's called TSH is 0.5 to 5.0. That's a way too broad a range. So people can go to these doctors and have these tests done and it shows that they're normal, but yet they're having obvious symptoms. So a better range is what's called the functional range. The functional range comes from data of healthy people who don't have disease, they have health, and this is the range that we want to use because we want to get you in the healthy range. We don't want to get you just barely out of the disease range. Like for instance, the functional range for thyroid TSH is 1.8 to 3.0, so that's a much tighter range. So we're going to find these people who are on the low and high end of the laboratory range, and we're going to find out what's not going right with that thyroid gland, and we're going to have very effective therapies to help those people. So a lot of people who are having laboratory normals, a lot of those problems are being missed, and so it's very important that we do a very thorough blood chemistry analysis because we can find things that are being missed. We find things that are missed every day in our office. Now, as we check your white and red blood cells, we are going to look at your immune system. Your white blood cells may give us an indication if you have a chronic infection that hasn't been found. As we look at your red blood cells, that's going to let us know if there's any anemia patterns that have not been found. Now, anemia is a very serious condition because your red blood cells take oxygen to your cells. So if you have a lack of or anemia situation, you're not getting oxygen to your body, that's going to make you tired. It's very important that we discover this is happening. So we're going to assess your thyroid, your adrenal gland, at least in part, your liver, your kidneys, your red and white blood cells with the blood test that we're going to do. And by assessing them, it's going to help us find out what's going on with you. With the blood test, we'll also be able to find out what's going on with your upper gut. Lots of people have hydrochloric acid deficiency, which is going to impair digestion. It can cause reflux problems. It's a very common thing we see in our office. And we do all these tests to really get you better faster. And that's what you want. You want to get better as fast as you can, and we want to have rapid results in our office. With the comprehensive metabolic profile, we'll also look very importantly at your glucose level. Glucose is one of the things that all your cells in your brain need for fuel. So if we have a low blood sugar situation or a high blood sugar situation, that's an impaired brain function. It's also going to be toxic to the nerves. The functional range for blood glucose is between 85 and 100. Now, if you come back with an 82, that tells me that you have a functional hypoglycemia syndrome going on. The symptoms of that, most common symptoms would be shaky or irritable if you miss a meal, crave sweets, and you immediately feel better after you eat. If you have a blood chemistry over 100, that tells me that you have what we call insulin resistance. Insulin resistance occurs when your body becomes desensitized to the insulin that your pancreas is making. So if your cells aren't responding to your insulin, you can't get any sugar into your cells, so that blood sugar is going to raise. Symptoms of insulin resistance, which is kind of a pre-diabetes syndrome, are craving sweets in between meals, and you also feel very tired after you eat. So in a medical practice, if you came back with, like, say, 100, 102, they would say, well, it's not diabetes yet, let's just watch that. And we'll wait until it gets to the point where you have a diabetes